Hello, everyone, and thank you for being here in such large numbers this afternoon at this webinar presented by the Canadian MS Society, featuring specialists of mental health and COVID-19. This webinar is part of a series presented by the MS Society to help people with MS and close people to get through this crisis. My name is Louis Adam. I'm the president of the Quebec Division and the Atlantic Division of the MS Society. I want to thank our partners without which this seminar would not be possible. Roche, AMD Sereno, and Biogen. Thank you for these partners who are very important. I just wanted you to note that this webinar is being recorded, so you can watch it subsequently, and you will receive an email with a link to tell you where you can find the webinar. If you have any questions during the presentation, please enter them in the chat box. We'll try to answer as many questions as possible. Ms. Primeau has a pretty comprehensive presentation today, but we might have a couple of minutes for questions. Please enter them into the chat box and we'll try to get to as many questions as possible. But if there are any questions we can't answer, we'll find a way to answer them later on. Now let me introduce Geneviève Primeau, who is our specialist presenter for today. Ms. Primeau has been active in neuropsychology since 2001. She is a member of the Quebec Order of Psychologists and holds a certificate for the evaluation of neuropsychological disorders. Her first job was in a rehabilitation center, working with clients affected by neurotrauma, such as strokes and head traumas. She has since worked for almost 20 years in a hospital setting with adults who have complex psychiatric and neurological disorders. She has also been in private practice for some years. In addition, she serves as a supervisor, lecturer, and trainer. She is known for her expertise in the area of multiple sclerosis. Geneviève, thanks for joining us. Thank you very much for inviting me. It's really a great pleasure for me to be here. I share with you here the screen of my PowerPoint presentation for today. Let me get this right. Okay, it's working. So we're going to talk about mental health in the context of multiple sclerosis, but with a little touch to add the additional context of a pandemic, which affects the way we experience our emotions recently. This is a summary of the presentation, and it's more as a reference here. The first point on which I will speak is speaking about emotional upsets and disturbances generally in the population, but also in people with MS, but even more now in the context of the pandemic and everything that comes with it. So we will go through these emotions, speak about them, describe them, and come with a number of pieces of advice and strategies to lighten up and reduce these. Before talking about difficult emotions, we have to say that the events that happens to us in life can make different people react differently depending on a number of things that belong to them. So that is the starting line. We don't all start from the same point, although our reactions might resemble one another for a whole lot of reasons. For example, our personality, our temperament, how are we as a person, our personality, our life experiences also, what we've experienced in the past, the lessons we learned from previous issues. Some things might have made us more fragile or more susceptible to some events. Our life experiences or situation also play a role. Are we single, married, with children, still working or not? All those are things that vary from one person to another. We should also speak about the social network. Are there people to help us? Are there people close to us? Are they far away from where we are? Are they affected themselves? Those are a lot of things that affect already how we will react to difficult experiences. And to you, we should add the fact that you have MS. And this is not general, because we know that MS varies a lot from one person to another. It's not just being with MS, it also depends on how MS shows up in your case. So let's go deeper into this and let's look at how MS is experienced by you. First of all, what is the extent of the brain injury in your case? Because some data tell us that the more the brain is affected by the disease, the more there might be emotional problems with people, because it is the brain that is responsible for analyzing things that happen to us and help us. So the more of a brain injury we have, the more difficult it becomes to react and to manage our emotions in a serene way. The location of lesions also can play a role. There are certain areas of the brain that are more involved in emotional management, especially the frontal cortex lesions, regions. So when we have lesions in these regions, it makes it more difficult for people to react in the right way to events that happen. The way that MS is experienced by you, it depends also on the magnitude of medical effects that you experience. At the beginning of the disease, people fare pretty well, but then some symptoms can persist as sequels, and those sequels or medical effects can be part of the baggage that the person has, to which we have to add other factors. Your experience with MS can be experienced also with some fatigue and sleep issues. We know that there's more fatigue with people with MS. When you have less energy, when you're more tired, then you might have more difficulty finding the resources you need to manage what's happening to you. Another factor is pain. Physical pain, sometimes that you have to cope with it, that you have to offset, and pain that can affect your sleep. And very often pain involves making arrangements in your daily lives that can represent a certain burden. And there is the issue of medication. Also, some drugs might have a positive effect on emotional management, but sometimes other effects that might harm. For example, some drugs have side effects on the level of energy and fatigue, and that can play a role with your emotional management and how you manage your emotions. Let's come up to the main emotional upsets or disturbances that might happen. Let's look at depression first. What is depression? Let's try to describe what it is, to try to broaden a little bit what it means to be depressed. We often speak about sadness, tiredness, fatigue, discouragement, boredom, or crying sometimes, tears. For some people, there's not so much that aspect, but what they experience is decreased interest for life, decreased enjoyment. So they do things that they liked before, that did them a lot of good, that they enjoyed, now doesn't stimulate them as much. Another aspect is melancholy, lack of initiative, lack of energy, feelings of worthlessness, guilt, gloomy thoughts. When coping with events that happen, you feel responsible for things that go bad. All those are symptoms that you can see in depression. And when depression happens, it can go all the way to gloomy thoughts and very dark thoughts that come up recurrently. Now, and let's speak about anxiety. What is anxiety? A few words about that. There are various words that we use, and in daily language, we often see them as synonymous with anxiety, but they're not always synonymous with anxiety. Stress, anxiety, worries, concerns, distress, they're all linked to the same concept. But if there is one difference to note, is to make a difference between stress and anxiety. Stress is to be seen as a legitimate reaction to a stress factor. If I change homes, or if I have a tire that blows up, that makes my stress level go up. So I'll be late, I get stressed. Will I get in time to the garage? What should I do? how should I call a mechanic? So there's a reaction that comes with a stressor. But when we speak about anxiety, we speak about a reaction that is a bit more problematic. Sometimes we use the word pathological stress when we talk about anxiety. It is the fact of seeing stress factors everywhere. We're more invaded and overwhelmed by these factors, and we perceive the little trigger as having a stressful connotation. That's when we speak more about actual anxiety. Anxiety makes you do all kinds of things. It can give you a feeling of insecurity, anticipation, anxiety, apprehending things that could go bad. It could lead you to want to control everything, trying to be a control freak because we're afraid. We're afraid of what might happen. And for some people, that will feed a need to control everything. They want to plan everything and be rigid with their daily routine to limit any unpredictable events and trying to prevent any issue. There's a feeling of being hectic, agitated. The person feels like when they've had a couple too many coffees, it moves them inside. It makes them more agitated and might create internal tension and agitation. For anxiety, generally, in the case of MS, we have to consider the fact that anxiety tends to express itself by bodily symptoms. It goes through the body, like tension in the neck, stomach aches, headaches. And when you have a neurological disease such as MS, the link is totally legitimate. And people think that as soon as they have a symptom, oh, that might be linked with MS. It might be a reactivation. It might be an attack of MS. Whereas actually anxiety may contribute to this symptom that can happen to you. Let me continue with mood swings. Mood swings are part of the most frequent emotional disturbances when there is a deterioration of mental health. What are those mood swings? I gave a popularized version here. Mood swings are sudden and rapid changes in mood that often happen with a very minor trigger based on frustration. There's a certain backdrop of frustration. The person looks good, seems to be cheerful and in a good mood, but it doesn't take much. And that person becomes, there's a reaction that happens, an intense reaction that happens when coping with a minor event. Mood swings is often used to designate irritability. That is a concept where you find the most literature. Irritability stems from a lot of things, possibly, very often with a backdrop of frustration, depression, anxiety, or certain aspects of personality may contribute to those mood swings. It's important to get worried about that because it's often a slippery slope. Showing irritability can then trigger guilt and remorse because you acted out, you spoke out loud, and if you're a bit depressive, it could feed and foster that depression because guilt and remorse plays even more on your mood. Since your mood is getting bad, people have even more angry outbursts or irritability, and it can become like a vicious circle. So that was a general overview of the different emotional disturbances and psychological symptoms or mental difficulties that may occur: depression, mood swings, and anxiety. Now, what can we do? What can we do personally, and what can we do in our relationships? What can I do personally? That means, first of all, I should recognize my symptoms. So the fact of that we've done this introduction about what it means to be depressed, what it means to be anxious, what it means to have mood swings, is to give you the vocabulary to help you self-analyze and recognize your symptoms. Recognizing your symptoms means that you go into your emotions. How do I feel? Irritability, for example. Anxious. It could be physical symptoms. I have stomach aches, tension in my neck. It could be cognitive symptoms, meaning thoughts that bother you, such as rumination, uh, turning around in your head, things that bother you, goes nowhere, it's running around in circles. Anticipation is another aspect, tending to think about things that could go bad in the future and becoming fixated on some worst case scenarios or things that could happen. There might be also some behavioral symptoms like not eating properly or being a control freak, anything that could happen, or being discouraged and procrastinating. That could manifest itself through an increased alcohol consumption or reduction in physical activity or having angry outbursts because of mood swings. There are various aspects that we could look at to help us look into ourselves and recognize those symptoms. Once these symptoms have been recognized, the thing is to clarify the source of those symptoms. It's okay to say, I don't feel well, but why? First of all, it is likely that at the basis there are things that depend on MS itself, because MS, with everything that it brings about, we know that it's quite a challenge for emotional management, especially because of the unpredictability of progression. Since people can't predict what will happen in the future, people tend to question what will happen to me, when will be my next attack, what will happen to me in 5 years from now or 10 years from now. Those are more difficult to deal with, even if you have no other stress factors. There can be other life aspects. Difficulty adapting. It's difficult for people with MS sometimes to adapt with the symptoms that occur. That becomes mental effects, and then people might need to adapt in their mobility if they want to go out or to sleep better, and the people have to live with that, and they have this burden of adapting constantly. Then in the current context, let us look at what are the factors, the additional factors that can contribute to these symptoms. There's the virus itself, but there are other aspects, because there are several collateral aspects to this COVID-19 situation. As for the virus as such, there could be the fear of catching it. Very often what we hear is the fear of passing it on to other people, to our loved ones, or people who might be more fragile or frail. Or it could be the fear of having complications following catching the virus. There are various fears are linked to the virus. Some people don't experience those so much, but they experience other kinds of collateral effects, such as this confinement, this lockdown, which leads to isolation. So we have less sources of satisfaction, less leisure activities that you liked before. Those are no longer available. There could be some impacts on medical treatment. They're less easy because there is no in-person consultation, for example, or public transit is not as accessible as it used to. There's less medical appointments on person. You have to use electronic means to get contact, and there's remote practice of medicine and so on. And those various aspects contribute to symptoms and emotional difficulties. There might be other things, such as financial constraints. We heard a lot about this recently, the financial impacts this had on a good portion of the population, unfortunately. Being crowded in your home, you too much together. You like your family, you appreciate being with your spouse and children in the same place, but sometimes being 100% of the time with other people is a challenge in itself. That's something that may contribute to emotional disturbances or upsets. This idea of coming out of your lockdown in Quebec, for example, we're starting what they call deconfinement, getting out of lifting restrictions. There's a certain fear that could be generated because of that. Once you've recognized how you feel, what are your symptoms, once you've tried to see what contributes to those symptoms, the ideal thing to do is to set priorities for action. Try to determine what is it that you can control. We can't address everything. We have a limited level of energy, so you have to go with priorities. Once this is done, once we have set our priorities, the question that we should ask ourselves is, do I have control on this? Can I do something about that to help me reduce the stress of the source of my symptoms? There are certain things on which we don't have a lot of control. And those are the things that we'll have to try to let go of, not prioritize. The idea is to preserve and save our energies, to pick your battles, and don't go beyond your level of energy. I'll give you an example of situations where we have to ask ourselves whether I can control them, because a lot of people have problems with that. We, in Quebec, we started talking about getting out of lockdown, lifting some restrictions in the last 2 weeks. And there was a great weekend where the weather was so great and social places were invaded by people, especially in the media. We had a lot of images on parks. Lots of people ended up being in the parks, and it made different categories of the population react, especially more vulnerable people. They question the fact of why those people expose themselves so much and contaminate other people. But this is a situation which is part of those over which we don't have any control. I think personally, and I think for a good part of our listeners here, there are decisions that are made by the government about lifting some restrictions, what is allowed, what is prohibited, and people make choices within the limits of what they can do. It's not something you can control. So even if you were to put a lot of mental energy worrying about that and blaming people for going out so much and getting so close and taking risks like that, those are most of wasted energies. You're worrying in vain. In those types of situations, there's a moment that comes where you have to say, this is a personal decision by these people. If I put too much energy on this myself, I will have less energy left to address things that are more important to me. So this is the type of situation that may happen. If you realize you have no control, you could be just change your minds, change your TV station, for example, listen to music or take your mind off things, try to distract yourself and entertain yourself in a different way. As much as possible, try to trust as much as possible the decision makers and the medical staff that helps you. There's a lot of people involved, lots of people that take care about the decisions they make. People seem to be in good faith. They want to collaborate. They want to help. They want to make the best possible decisions. So let's trust when you can't control. Let's be able to trust other people who are decision makers. Let's trust their capacity to get well informed before making choices. Sometimes there are situations where you feel that you have no control, but there's an angle sometimes where you think you can have some control. If I kick back to my example of people walking in parks on a nice Sunday afternoon, even if it makes me react, in our house, we're allowed to decide where we want to go. Do we want to go in the park or not? And if we want to walk, there could be another place we can go where there will be less people, a back alley or some place around your house where you can take some fresh air to take advantage also of the nice weather without taking undue risks that other people seem to be taking. So sometimes there is a way of looking at a situation and to regain some level of control on what you can do. And when you get back some control, the importance is to take that control and to take action. Now, let's get to how do I take action. Getting into action means first informing yourself. What you're doing right now is doing that with the other webinars that were organized for you, informing yourself. But when you inform yourself, you really have to take care of the sources of information. We say that again and again. It's very important because you get everything on the social media. You really have to see, where does this come from? Who does it come from? So much so that there were a lot of fake news or sensational news linked with COVID, to the point that there are television programs to undo myths or things and myths that occur that are not coming from reliable sources. Sometimes you have to limit your time for information to avoid overexposure to stressors. Yes, you get informed, but too much is like too little. At one point, you have to try to dose and moderate the time and energy you devote to get informed, because it can become overwhelming. Same thing for social media. Moderate your time. It could take up too much of your time and energy. Taking action also means looking after your own MS, taking care of your MS, because it's still there. You have to take care of it. So maintain your medical follow-up, your medical appointments, keep taking your medications and treatments if you take some. And it's important to know that there's really a wave of remote practice that has invaded the health fields in the last few weeks. It's been put in place very efficiently. All kinds of nurses and doctors and even physical therapists who work virtually. So people are transitioning to teleconsultation, and some people are coming back remotely now. It's getting organized. Now, taking action also means taking care of yourself. I'm not teaching you anything new here. Those are things we know, but unfortunately, we tend sometimes to forget about those things. But we should come back to some basic things. Taking care of yourself, like practicing some physical activity to relieve my stress and eliminate my tension. There's a certain trend in MS. Since people have a lot of fatigue, they tend to limit their activities. But then you end up in some kind of a vicious circle. Since people um, work less with their muscles, they lose their muscle tonus, and the least effort becomes tiring, and the least activity becomes difficult, and it's a vicious circle that happens. It's important to put on your schedule some physical activity within the limits of our capacities and potential. Adopting healthy lifestyles, we all know that. But when you're taken up with all kinds of worries and concerns, we tend to put that aside. Eating properly to get enough energy, getting enough sleep, so that I can think about my situation and being able to get into action. That's the basic. Getting enough sleep. Be moderate in your consumption of alcohol and cannabis for the same reason. We try to have as much time as possible to optimize your capacity to think and to optimize my capacity to use the resources available to me to address the emotional difficulties that happen and to improve our reaction to those difficulties. Giving ourselves little pleasures, little treats, enjoying taking a bath, not too hot, of course, in MS, of course, reading, listening to music, treating yourself to some little pleasures like that to make your life pleasant and more enjoyable. In the context in which we are now, giving yourself those little treats, it means being creative, because a lot of those recreational activities we used to do before are no longer possible in confinement in this lockdown situation. You got to be creative. So, for example, with the social media, what can I do to change my mind, to get my mind off my concerns? Getting on YouTubes that will make you move, yoga, physical exercises, or arts and crafts, something more manual. So it's nice sometimes to get out of your daily life and trying to do, what could I do that would be new and rewarding in my life to enrich my daily life. Taking care of oneself means also relying on winning strategies that were used in the past to get through difficult times. There have been times we've had difficult times in the past where we had to adapt. There are lessons that were learned from those events, and strategies that you used in the past can now be applied to adapt to new challenges, even if those challenges are different. Since the daily life becomes monotonous and boring, especially if you're self-isolating, it's important to offset that. For example, someone who's no longer working, no longer has the satisfaction of working, and ends up being at home, then it's important for the person to continue to find ways to motivate themselves to doing tasks, to do things. It could be doing some cleanup in your house, a spring cleanup. When I finished with my clothes, I'll take a few minutes to read part of my book, for example. Little things like that will take away the burden of, oh, I should clean the whole house. It's going to be long. It's going to be difficult. Take it and help your motivation. Take it slowly. A second point is to respect your limits. It seems like a cliche, but it's really important. The fact that respecting your own limits, your energy. For example, this means that if there are things which you know feel like doing because you had some bad news, or you don't feel so well because of your MS symptoms that might be more severe, it's important to respect that and not to put too much pressure on yourself. Take a break. Sometimes when you're tired, you have a headache, or you have financial constraints, possibly you have some angry outbursts. It's part of life. It's part of what might happen when you are a human being. So learning to respect your own limits and not put too much of a burden on your shoulders so as not to put too much pressure on yourself and too many constraints. Learning to delegate and accepting help from other people. That's part of the things that we often repeat, but it's so important because accepting help from other people is a challenge. People often feel that if they ask for help, they will bother other people. But what we know is the people that get solicited for help feel useful and have the feeling that they can do something, and they get something from helping. So it's important to deconstruct that notion that, I don't want to bother other people with my problems. Very often people will be more than pleased to help. So it's nice to see if there's someone that could help me. Seek out humor and lightheartedness, diffusing difficult situations. That's a good strategy because we're in a context where there's a lot of thinking, a lot of uncertainty. So it's important to add a little bit of humorous touch. There's a lot of jokes and cartoons that go around. And just a smile, it makes us smile occasionally or laugh out loud. It's important to add this to your daily life, something to lighten up the difficult climate that is around us now. Engaging in relaxing activities. I'm thinking about yoga, meditation, mindfulness exercises. You can go to YouTube sites and type the right words. They will give you a panoply of video, a whole lot of videos that could help you. And you might discover something you don't know. Be careful with your sources again. But there are well integrated activities that can relax and reduce anxiety. Taking action, also learning to relativize things, reframing information. When you've got a lot of information, sometimes it sticks and turns around in your head. And I'm trying to take an example. Reframing information means, for example, when we hear, oh, we're in it for a long haul, we're not out of the woods. It might last for 12 months or 18 months. And we hear that, oh my God, this is not over soon. But it's important to think about those negative phrases and see that there's still hope. There are good things that happen. There are teams of researchers around the world that are acting and collaborating as they never did before. They're working hard to get a vaccine, and companies are studying vaccines. They don't produce. They are producing vaccines to make sure that they can deploy those new vaccines. So, yes, we're probably not. It's not going to be over in a week or tomorrow morning, but a lot of things are being studied to limit the duration of this crisis. Another phrase we often hear, lots of people are sick. We show numbers of people who are affected or infected. On all news sites, we get numbers of people who are sick. We have to reframe this and make it relative. We can say also a lot of people have the virus but remain asymptomatic and didn't even realize, like children. So yes, there's a lot of sick people and a lot of people are not, and a lot of people have the disease without having any symptoms. Next thing to watch is these phrases saying that the virus is highly contagious. True. But let's not forget that for many weeks and months in certain parts of the globe where they saw this virus emerge before, there's a concerted effort to implement effective measures to limit the spread of the virus. And those measures are working. For example, people are having the reflex of washing their hands thoroughly, good hand washing. And we see people covering their face in different places, people taking initiatives, wearing masks. People develop measures to be at a good distance from the people they're talking to. So there's a lot of efficient and effective measures that limit the contagiousness of the virus, which we hear so much about. Last point, which I wanted to bring as an example, is the fact that COVID can kill. Yes, indeed. We know it increases the mortality rate. But when we analyze the numbers, we realize that most deaths occur in people whose health was already fragile and precarious. I know very well there are exceptions to all of those things, but if we think about those things, it's good to take a step back and to reframe and place ourselves in the right way to look at things. Most of the deaths occurred in people who already had very bad health and already had some great pressure on their health. So that changes a little bit the perspectives and the fears you might have. Taking action also means finding solutions to limit financial consequences. Those are points that are often mentioned in the present context of the pandemic. There are some people who don't experience so much fear of the virus, but they have collateral difficulties, such as financial difficulties. We have a new division or in general society. How can I get into action? How can I track my expenses? I can plan my expenses. I can plan my budget. I could apply for financial compensation programs. I'm surprised to see all the websites by the government of Canada. It's pretty clear about what we can apply for and what can be done. Ask to defer your mortgage payments or your loan payments. Several financial institutions now accept defaults in your loan payments. Or it could also mean getting help from community organizations. There's been quite an important government effort to offer help, in particular food banks were increased to support people who are going through more difficult moments financially. Another thing is to consult specialists, financial planners, accountants that can help you and put in place some possible solutions. Another point, there's the crowding or intensive cohabitation with other people, too much togetherness. How can you manage this? When you're creative, you can find all kinds of solutions to try to soften up the situation a little bit, being overcrowded. For example, you can agree on a schedule for meals and bedtime with your family. If you're two people, one likes to go to bed early, that could help or create frictions. Sometimes you can find compromises and find adjustments. Another thing is to decide on time slots for sharing the television. That could be a source of irritation. That could be very bothersome during the day. So sharing the television fairly. Once things have been said, it's important for everybody to avoid renegotiating agreements all the time. Every week we can renegotiate and change a little bit the game plan. Managing overcrowding also means taking advantage of this opportunity to develop my children's sense of autonomy and responsibility. They're more at home now, they're always there. So it could be an opportunity to show them that they have a bit that they can do. If you are working remotely and you hear your children saying that it's time to put the clothes in the dryer, maybe they could give you a hand and put the clothes in the dryer for you. So it might be an opportunity to develop what your children can do for you, or learning how to do the dishes. It's a good time to try to be more autonomous and take little responsibilities in the home for everyday chores. Another point is to reach an agreement with the employer to adapt my schedule to my reality. For example, there's a lot of telework that is possible, and it's very difficult to do this with young children. For your brain, being distracted, resisting this interference is a drain on your energy level. So the thing might be to agree with your employer to say, I might be available in the afternoon after my nap, and I will work a little bit in the evening to offset the time off. So agreements can be reached with employers. Otherwise, it might become too demanding. As for school for children, in Quebec, there's a lot of initiatives for the children's education. Lots of good initiatives were taken, and the Ministry of Education has put in place all kinds of resources. But for big problems, if you don't know those resources, you have to offset for the fact that children don't go to school. It could be calling your teacher. I suppose most teachers will help you and guide you towards the appropriate resources to help you support your old child in their educational path. Learning to manage with the togetherness, taking care of yourself. Teach the kid also to take care of himself or herself. At one point, it could help for those children to go out and take a walk, breathe some fresh air. Helping your children take care of themselves. The thing is to help them eat properly and have a good balance in their lives and in your life. Now, as we know, we're gradually evolving towards a lifting of restrictions, coming out of lockdown. We're coming out of isolation, as deconfinement, as we call it. There are guidelines given by the government, and there are individual choices to be made in this. How can you do those individual choices? Like, will I go to do the grocery, or will I still have it delivered? Do I go out? Should I wear my face covering or not? To make all those decisions, it's important to rely on verified data and facts to really assess the risks. For example, I know that the MS Society has developed a very interesting information on their website so that people can understand the risks related to the disease. Once we know all those facts, which are appropriate for your specific situation, which parameters do you really need to consider for you in your specific situation? Avoid comparisons with other groups, other provinces and countries. Each has their own reality. For example, we've heard a lot that in Canada, things are worse and are going well in Quebec in terms of lockdown restrictions, but there's a lot of qualifications to make there. For example, deconfinement is mostly outside of the island of Montreal, which represents half the population in the province, and these people remain confined and under lockdown. We have to know that in Quebec, the disease touches most particularly centers for the elderly, so there's a lot less of community propagation. How can we compare with other groups? Sometimes it could be deceiving if we don't have all the data. It's difficult to compare the lifting of restrictions from one place to another. If we have difficulty making decisions for ourselves, should I get back to work? Should I get out of the house or not? Sometimes the thing is to think it out loud or think it on paper. Write it down, or give yourself the time to think about it. Sometimes there are no decisions to be made right now. You can wait a couple of days, some time to digest and absorb the news. And how can we position ourselves with that and talk about it with people that you trust, giving yourself the right to change your mind, because the situation evolves very quickly. We learn new things every day. So possibly at one point I say, yes, I'll wear a face covering, but no, it doesn't apply to me. In my case, I don't really need it, or whatever. We have the right to change our minds. So it's not so much of a burden on us if we say, my choice today, I can do this today, and tomorrow I'll see where I am. I'll deal with it. I'm allowed to change my mind. Also, in order to make decisions about getting out of self-isolation, it's important to let other people their own opinions, the possibility of making up their own minds based on their own reality. For example, in the case of Montreal, maybe some people went in a given park on one day because they live in a 3.5 with 3 kids, and for their own mental health, they just needed to see trees and nature and the sun. And sometimes making judgments based on our own opinions, let's remember that people have their own opinions, and let them make their own decisions based on their own reality. Taking action is a continuous process. There might be setbacks when new data comes in and new information comes in, new events happen, but it's a continuous process. This graph that I'm presenting is based on literature about the steps of mourning that was taken up by a group called the Enneagram, if you're interested in looking into that, but I wanted to put this here. The first step, which we see, is a shock. Like when it happened in March, come on, that virus was in China. How come? How can it really happen here? We were all in a state of shock. After shock, there's denial, rejection. We don't believe. It's just a flu. It's not any worse. It's just for old people. I'm young. I don't have any problem. It happens to other people. It will not happen to me. So we're in denial. We have the information, but we have difficulty accepting it. Often after that, anger and irritation, upset. When we had the lockdown, for example, closing schools, we want this lockdown. Close schools, close businesses. Come on, guys, what's happening? We should close everything down. We shouldn't let anyone go out. Then there's fear and withdrawal. People start thinking about themselves. They want to protect themselves. We in Quebec, we had this saga of toilet papers. People buy lots and lots of toilet paper because people wanted to stock up on things that they used to buy in stores because they were afraid that there would be shortages. Since this was on the social media, we had a lot of things who stocked up all kinds of things, and toilet paper in particular. There was a rush on toilet paper. We went through that. People were scared. And that illustrates this aspect of fear and withdrawal. After that, the next stage is very often sadness or meaninglessness. What's the use? What is this? Oh no, I'll just wait until it gets through. I'm not doing anything anymore. I'm not undertaking anything. I'll wait for the storm to go by. Then there's often an idea of trying something new. If I tried something new, just in case it could work. That's what I was mentioning earlier when I was talking about creativity to find things that will make your day more pleasant in your daily routine. These attempts lead to little successes. Oh, I liked it. It did me a lot of good. I'll try something else, and I'll try an activity that I've never tried before in case it helps. Then you get into action and you get more motivated. And eventually, the idea is to come to adaptation and reconstruction. So we're doing our best in view of circumstances. Circumstances always change, and there could even be positive effects to all those issues. A lot of people said that being self-isolated, being under lockdown, changing your daily routine made them center and focus on things that are really important for them. And maybe when all this is over, we might go softer in the rush to 100,000 activities and focus more on little activities that give us a lot of rewards. So let's give ourselves a break. If there is one notion to remember, that's one. Let's give ourselves a break. Let's be aware that the current situation leads to extraordinary challenges that can vary depending on our personal situation. So we go through trial and error. It's not always perfect, but after trying different things, some efforts will make things go better and will make positive changes. And if we're giving ourselves the time we need, things will go well in the end. Then I'll come to the aspect of relationships, how important relationships are in the current situation. That was repeated more and more recently. We don't want social distancing. We want physical distancing. Our goal is not social distancing, it's physical distancing. Our relationships are becoming ever more important in this situation. Another thing, asking for help is not a sign of weakness. It's a sign that you're strong enough to take steps to make things better. Asking for help is at the center of the strategies we should develop, and helping other people also often gives us more in return than what we give. So mutual help in this context helps the person who solicited help and does a lot of good to the person who helps. They feel useful, they feel appreciated, they feel that they have a contribution to make. In my relationships, it's important, as always, to wait for the right time for discussions. And the right moment is not necessarily just having the time, is to be in a good dispositions. Wait for a time when you're calm and open-minded to other opinions. The important thing is you want to share your mental health tips and encourage people, and the way you applied those health tips. Encouraging this sharing is very rewarding when we can encourage yourselves with friends. I tried this, I tried that. This didn't work, but give yourself a second chance and we'll finally succeed. It's not enough to confide into others, but it's important also to state what you expect from the others. The people around you should not have to guess what you need. It's important to tell other people how you want help to be given to you. You still can't cope? Well, there's another level you can go to. The question I'm often asked is, when should I get help from professionals? The best answer is it's never too early. That's the best answer I can give. Maybe you don't need it so much. At least you will benefit from some support, advice, encouragement, and your professional person is a professional and will reflect that to you and will propose meetings, remote consultations, and you can remind them if other needs occur. It's never too early to consult. When you consult, you have to be careful about who to consult. There are various types of professionals. There are psychiatrists, there are doctors who are mostly involved with more severe problems or issues when there are issues with drugs and psychiatric medications. Psychologists are more into general psychology. They had a PhD in psychology to understand human beings and understand all the factors I was mentioning, your temperament, your life environment, and how this influences people. There's social workers also. Social workers, most of them are women, and they're very much appreciated when you have to act in a system, in a family, or in a network. Social workers can bring help and support. Let's be careful with the word therapist. I can speak to you about the situation in Quebec. I don't know so much about other regions. In Quebec, this is not a reserved title. Someone who says, well, I'm a therapist, they don't necessarily have all the same qualifications. You got to be careful about who you consult to consult the right person. And when you consult, please clarify, you should clarify your needs and expectations. Successful treatment requires a partnership. You have to state what you expect, what you want to work on. When you're not too comfortable with a suggestion or advice, you have to say so. You have to adjust your relationship and evolve through it. I come back to this idea that most professionals will do remote consultations now in various fields. There are people available if you need them. My last slide here concerns resources that could be useful, that you could look at. I put resources in both English and French, government resources, government websites. I would like to add a site which I discovered yesterday. It's called the Canadian Mental Health Commission. Canadian Mental Health Commission. You can look it up on the internet. They have several hyperlinks. To conclude, I still have some time for questions. I would like to speak to you about this story of the oak and the reed. It's often used in psychology as an analogy. This oak and reed fable tells us that this oak tree that looks very tall and strong, well, is not the one who will best resist if there's a big wind. Maybe it's the little reed, the little piece of herb that is besides that can adjust to the environment, can bend and adapt, and sometimes that's more of a winning strategy, and that could be a better strategy for resilience in the front of anything that can happen. Thank you very much, Geneviève. Excellent presentation. That was very interesting. I'd like to remind people that Ms. Primeau's presentation will be available on the MS Society's website under COVID-19 in the coming days. You can also access the last webinars that were presented. They're all on the website. Now I will open up question period. We have a few minutes for questions. We had a question on the chat box, Geneviève. The question is, can we have access to the list of psychologists available, for example, and where can we find that list of psychologists? You can find this on the Ordre des Psychologues du Québec website. There's a member services tab, the Order of Psychologists of Quebec. You can call them to ask who is available in your area. Sometimes they call this health-based psychology. People identify themselves as being health psychologists. Either they work with people who have MS or brain trauma, brain injury, or other psychological diseases. There was another question, Geneviève. Your presentation was extremely interesting. Can we have your PowerPoint? Yeah, no problem at all. Yes. So yes, we'll share it. That's the goal, because there's a lot of vocabulary to give ideas to people. People want to go further on the internet. At least they will have the right keywords to get to what they want to get. There was no more other question on the chat. Anybody would like to ask questions now to Ms. Primeau? Well, That's about it. It was clear. We're just a few minutes away from the conclusion. I would like to remind you, as I said, that the PowerPoint will be available on the web, and the webinar will be available on the COVID-19 tab of the website. Don't hesitate to call upon people at info MS. These navigators are there to answer all the questions about MS, but also about COVID-19. We try to always have the fairest and most up-to-date information. The next webinar will take place on May the 28th. The title will be Building Resilience for Caregivers, Mental Health and Physical Activity. This webinar will be in English with simultaneous translation into French. It will be offered by a mental health educator holding a PhD and a postdoctoral fellowship. You can register pretty soon on the MS Society's website or on the Facebook page. We also have a peer program for people with MS and caregivers to ask questions, and you will get an answer by email or by phone. I invite you, of course, also to visit the wechallengems.ca, which is the best site for MS right now. You'll see all activities that are taking place for us one day to have a world without MS, which is the vision of the MS Society. Ms. Primeau, once again, thank you. Thank you very much. Thanks to our partners, Biogen, Roche, and MS Sorono. You will also receive a survey to answer and tell us your level of satisfaction regarding the webinar presented. Don't hesitate to fill out that survey. That helps us a lot. On this is 2 o'clock sharp. I wish a great afternoon to all. Take good care of yourself, and thank you for attending our webinars. Have a great day. Goodbye.